Hey, y'all, and welcome to another edition of the Unscripted Huddle, brought to you by the National Football Alliance. The NFA's purpose is to honor, improve, and advance the sport of tackle football. If you're the parent, coach, or administrator of a youth or high school player, you're in the right place. We aim to deliver an authentic voice regarding performance, safety, and the medical truth to support you and your players. My name is John Reagan. With me is Joe Rafter. Let's kick it off. Welcome back to this edition of the Unscripted Huddle, sponsored by the National Football Alliance. We are really excited to be here tonight. It's been a while. A lot's been going on, and I am John Reagan. We have a guest tonight, but first let me introduce, fresh off a Super Bowl victory, my co-host Joe Rafter.
So much to talk about, John. It's been a while since we've been here. Alicia, we're going to drag you into some of this conversation. I know you're and we're going to get your opinion and thoughts on a couple of things, inclusive of, the work that you do, but also beyond that. I'm just on cloud nine. I really am. But I'm going to pause. I'm not going to go down that path.
Oh, come on. Well, let's go ahead and go down it, Joe, because we know you got parade prep for tomorrow. I'm sure you got people coming into town. I'm sure Son's coming up from D.C., right?
It's not. My son's going to his girlfriend's up in Connecticut because it's Valentine's Day.
Oh.
He's a good kid. My youngest is coming with me tomorrow. We'll go down there and he'll get a little dose of the Philadelphia Mayhem. But let's pause on that because I'm excited because we have the first additional member of our management team in the National Football Alliance with us here tonight. That's Dr. Right. Alicia Trbovich. Alicia, great to see you. Thanks for joining. Tell us a little bit about yourself. How did you, what do you do, and how did you find your way into this?
Oh, boy. Okay. Well, I think that I found my way into this because we have a mutual friend who thought that I would be into this. She just knows what kind of football fan I am, and I have little kids now, so I'm kind of real into the kids sports scene right now, I guess, more than most people are. And then in a broader sense, I guess I should tell you I'm a concussion specialist, a neuropsychologist that evaluates concussions day in and day out, and also university affiliation too. So I do some research as well. So I work for the University of Pittsburgh and UPMC for my day job, so to speak.
Awesome. So, Alicia, for our audience, Alicia is our Chief Medical Officer of the National Football Alliance. And so we asked Alicia to, be a part of our management team because head safety is important to us. And there's lots of discussion out there, lots of false narratives, quite frankly, around our sport. And there's real science to be understood and learned by our parents who are listeners, our coaches who are listeners. Mm-hmm. And so because that's important to us in the National Football Alliance, we wanted somebody like yourself, a practitioner who treats patients, combined with the research background, to be on our staff in the National Football Alliance to help guide us when we have questions about the truth about the brain, the truth about neuroscience. We have someone who is a trusted voice. So, Alicia, how did you get into neuroscience? How did you because I'm late, I'm much later in life. If I could do it all over again, there's one or two or three things I would do. Number one, I'd be a lead singer in a rock band. That I would love to do. I think that'd be a blast. Number two, I'd love to be a neuroscientist. I don't think I have the brains for it, but I find it unbelievable. How did you get into neuroscience?
Well, you're right. It was a little bit trendy in my time. So when I was an undergraduate, that was a major that was popping up. But not every university had it. In fact, mine didn't. And I have a dual biology and psychology major. So I kind of blended those two. And I got into neuropsychology because I thought it was so interesting that you could do all these evaluations on intelligence and, identify learning problems or, certain types of conditions, you could evaluate brain injuries. I just thought that was all very interesting. And after a while, I soon learned that it was a very depressing field for a lot of the things we look at. Like, oh, you have Alzheimer's disease. Be prepared to have more of a decline. Essentially, almost everything in my field is doom and gloom, unless you're doing a condition that you can rehab. And concussion, people get better from. People recover. They're back to their own normal self. There's not a whole lot of things in my field that you can do that you have that outcome. So that really excited me. Plus, I love sports, and I love working with athletes. They're a different type of person compared to the general population, which I do. I will say I also do see people beyond athletes. I see like car accident victims or falls or other kinds of head injuries. But, mostly at least half of what I see is athletes who sustain concussions. And I loved it. I loved the working with, motivated, active people. And I just love that it makes such a difference, helping people that otherwise would have changed their life, perhaps decided not to continue to play a sport because of a concussion or that's just an example. But so that's how I got into, I maybe already digressed because at first I had no idea. I just thought, oh, the brain's really interesting, real cool, like there's all these neurons and this makes our behavior and well, that's neat. And, then you kind of find your way as you're like in school and you're like, oh, okay, I guess I'm going to veer off this way. And then I'm going to veer off that way. I'm going to try to get, a fellowship in this to specialize. And, but yeah, I started with just like more basic and then realized, ooh, I think I want to do this. And I don't care if I do it every single day. It's what I want to do.
It's awesome. So along my time in football and learning about the brain, one of the things the brain's an organ, right? Is it an organ?
Yep. It sure is.
Ding, ding,
Perhaps
ding, ding,
one of
ding.
the most important one.
John, you're halfway there.
John.
You're halfway there, Joe. Halfway there.
Heart and
John's-
brain. You can't go without those.
John's smiling because he didn't know it was an organ. Kidding.
What are the other options if it's not an organ?
I don't know.
Thank you. I appreciate your help there.
So I think I've learned this, that it's the organ we know the least about in the body.
Probably because it's the most complex. And so there's so much we don't know.
Yeah.
So yes, I would agree
So
probably.
true. Okay, true. That's
It's a subjective question, but I would agree that, yeah.
yeah. I mean, it just I don't know. It for me it feels like it's this it's a frontier that isn't necessarily as well understood or known as a heart or liver or lungs or all these other things. Mm-hmm. Because of it is so complex and it is inside the skull and it's just got I think there's different dynamics about the brain from my point of view than the other organs in the body.
Yeah, I mean they have different cells, like neurons are just your nervous system. You have nerve cells in like your nerves, yes, but like in a muscle or whatever. So I think that they are the most different cells, and then the way they communicate is quite different, the electrical chemical signal. So you definitely have a lot of unique things about brain and brain cells that kind of added the complexity.
So staying in this a little bit more, can you tell us a little bit about the concept or the phenomenon of neuroplasticity?
Mm-hmm. So that idea is that, okay, so you can have an insult to the brain, whether that be, a brain injury from trauma or a stroke or something happens and your brain can adapt and compensate for that insult. And we used to say that kids would have the most neuroplasticity. And that might be true for a lot of things. They're young, they're healthy. we lose brain cells all the time. We have, and it's normal. It's just normal. It's called pruning, actually, is like healthy brain cell loss. Like your brain just doesn't need all the cells that it started with. And there's only a few spots that actually regenerate neurons as you're, at age. But in any case, we have brain cells die all the time and they adapt, and there's different connections, or what we think of as networks in the brain, and the way that the cells kind of propagate information, and your brain can adapt and change if there's something that happens to it. Or I think you can even use neuroplasticity in a different context of, like, say you're just learning something new. So you're learning to play football and you're like 5 years old and you're learning the throwing and the catching. Obviously, the way that your brain fires up is going to be different than the 5-year-old who's never thrown a football and the one that has for 3 months. So, it's that interaction with the behavior and then what your brain is doing, but you would probably see different activity in the brain of someone who's practicing something, because you could say that plasticity, or that's been primed, or those networks have been developed. Everybody's a little different. We have all these like localized areas in the brain. We're like, oh, this is the language center. This is the frontal lobe where we have executive function. But everybody's a little different. Like maybe your language is a little bit more posterior than average, because when they do brain mapping for different surgeries, they find that it's not as simple as the diagrams, right? You have the diagram, you can learn the figure. Oh, here, this is where this is where that is, and everybody's a little bit different. So the brain is a very plastic type of organ, so to speak. Yeah, that's
cool.
What I would say about that without any additional prompt.
Yeah, that's cool. I like to think when I meditate, I'm developing neuroplasticity in my brain.
Yeah.
Right?
You're training it up.
I'm training. I'm
it's
creating
a hard thing.
New connections, new firings in the brain,
Absolutely. I feel like most people can't get to meditating because they can't get past the beginning stages of being so bad at it and actually developing it.
That's the whole point of it.
Yeah.
You're supposed to be bad when you start. Yeah. So, okay. So I think that's good first down. Should we move on to second down, John?
Yeah, I was going to say you guys lost me somewhere along the lines of neuroplasticity and mapping and all. My only thought was, I'm thinking it's probably one of the, if it, and your answer was subjective, so it's obviously a subjective answer, but if it is the least known or the organ that we know the least about, it's probably because it's pretty hard to study, a live one anyway. So you mentioned mapping on that, but you're right. Let's move on. I'm going to take us down the wrong path if I don't. From my standpoint, I sit and I hear you talk about, I hear about neuropsychologists. I hear you talk about some of the things you're talking about, and knowing that you work in athletics and you work in football, and there's a lot of people out there that would say that that's almost contradictory. But at the same time, I want to unpack that a little bit. I mean, there's obviously a reason beyond divergence from what you thought you wanted to study to getting to where you are that brought you there. So just curious about that, and any thoughts along those lines.
Mm-hmm. Yeah. So, I mean, when I was coming up on deciding my specialty, I do remember trying to dig into the whole idea. CTE was very much just coming alive. This is like late 2000s. So, I mean, we're talking maybe, I'm old, 15, 17 years ago, and, I'm trying to do a paper. A lot of all this stuff is like really old papers from like, I'm not kidding, like 1930s, like Punch Drunk. I'm like super fascinated in this. And I mean, there wasn't the new stuff that we see now on the brain bank and stuff. And it was all about like just literally methodology from the early 1900s. And so you think about, it made me think like, wow, so you go around and you hear like a primary care doctor say, hey, 3 strikes, you're out with a concussion and you shouldn't play anymore. That is literally something stolen from some doctor in like the late 1800s. Like what else do we follow recommendations on from the 1800s or early 1900s? And so the funny thing is nobody paid any attention to a concussion because, like you were just saying, John, there's like no way to measure a concussion in such a I mean, there's a lot of ways to measure a concussion. That's my job. But in a so objective way, it's so easy to just show the patient. Like, if you pull up a stroke, you could pull up the imaging and show the patient, be like, you see that shouldn't be there. You can't pull up any sort of imaging and be like, well, here's the concussion. In fact, patients are confused because they get a scan at the hospital and they go, well, they said the scan was fine. I was like, that just means you don't have a bleed in your brain, a skull fracture. That just means nothing more significant happened when you hit your head. That does not mean anything about a concussion. A concussion has to be measured with brain function. And so there's this whole like, well, we don't really know what to do about that. It's not really that real kind of vibes sent out in the like, so we had the 1930s, we had like this punch drunk thing where there's some doctors out there that think it's not real good to get hit in the head, which I do agree with. Boxing is probably not very good for your brain. But then we moved to the point where, 60s, 70s, 80s, the pendulum has swung 180 and nobody even really believes like a concussion's a real injury. It's more like, oh, okay, can you get back out there? Are you cognizant enough? Is your mental status adequate that you can continue to play? And then we took another 180 about 20 something years ago. And it was like, oh no, now we have to brain rest. Concussions are bad all of a sudden. And right. We should need to take them so seriously that people should be basically locked in a dark room.
Right.
And now we're kind of working our way back to, hey, we shouldn't ignore these, but also we should definitely not be locking people in a dark room. And we definitely can't say for sure that all these people are going to end up with, severe brain health problems later in life. That's also not appropriate. So,
Alicia,
yeah.
Can you talk a little more about, obviously a lot of what you have to do is diagnose, and or at least evaluate. Maybe yep. Diagnosis is a tough piece, but evaluate. What are some of the things now that are out there? Because the things you talk about from the 1800s and even the 1980s and even 10
or
years
even like
ago,
the smell it.
Yeah, it's almost like anti-science. In all honesty,
yeah.
It's wives' tales. It's anecdotes. But now there is some science, there's some thought to it.
Yeah.
And I think that's what scares people, right? Like if you start talking about things that don't have any background, that's what scares everybody.
Yeah.
What are some of the things that are out there that help you in the diagnosis, that help you in developing as they start talking about, and probably talk more about here, return to play protocols and things like that?
Yeah. So evaluations, we call multi-domain evaluations now. And of course, that symptoms are the most obvious thing, but you always got to be careful because symptoms are a subjective thing. You could not want to tell your symptoms. You could just not really feel your symptoms. That's limited. So we have cognitive testing, like thinking, memory, concentration. That's like the bread and butter of being a neuropsychologist is what we do is, what's your processing speed? What's your reaction time? How well can you remember this list of words, these shapes? And we know how people should normally perform, and then we can determine if somebody falls in that range, or they can have their own personal baseline, which a lot of athletes do. And then you can compare them to their baseline. So they get a test before the season starts, so we know what they look like. Do you have a really strong memory and only an okay reaction time, or vice versa? And then we can tell if they digress from their own personal baseline. Then there's other things we look at, like a vestibular function, ocular motor function, autonomic and exertion tolerance. Sometimes athletes say they feel just fine, and then you start to exert them and they get a headache back. So those are kind of the main domains. And then you can see just different like phenotypes of chronic concussions, like a post-traumatic migraine, or that's the main one that you see would be chronic. But so now we have different like profiles, different clinical profiles, and different presentations where we can identify what exactly is going on, and then that helps us guide to what targeted treatment we need. So now it's really more like, you wouldn't say if you blow out your ACL, you wouldn't go around and just being like, well, I have a knee injury and I'm just going to get knee surgery and there's protocols for a meniscus versus an ACL versus whatever, Right. So it's kind of like that with concussion now. It's not just like, oh, you have a concussion. It's like, oh, you have a vestibular concussion. Like if you don't have vestibular issues, you don't need vestibular therapy if you have a concussion of a different subset. So that's kind of where we're at now, where we can figure things out. Sure, I think our tools will continue to be refined and improved, just like everything in medicine, but it's definitely significant progress in the past 20 years.
Alicia, are there different types of concussions?
Yeah, I mean, so we call them subtypes, or we call them clinical profile subtypes. It depends on who you talk to. They're all essentially the same mechanism, right? You either have to have the force applied, whether it be direct force or a whiplash or something, to cause the brain to shift inside the skull and cause the stretching, the cell membranes. But so then you can, again, I would call something a vestibular concussion, or
vestibular is a big word. That what can you give us
of course,
average football coach's interpretation?
Oh yeah, I sure can.
Or a below average football coach's interpretation.
You guys care a whole lot about the vestibular system, so I explain it to patients as it is kind of a complex network in the brain that processes space, motion, and movement. It kind of integrates a lot of your senses, and you think of the balance with the your inner ear, but that's peripheral. So that's your peripheral vestibular system. More, we're talking about when all that information is processed. So when you move your head, your eyes reflexively move. If they aren't moving right, they're lagging behind, they're not processing, you're going to feel this weird, wavy, disorienting dizziness, which is not good for playing football or any sport really. But so there's a whole subfield now. This is a little bit of digression that's looking at orthopedic injuries after a concussion, because if it's questionable if they weren't fully recovered, there's an increased risk, it seems. So, any case, the vestibular system is a very important important subtype of concussion for athletes. So, if say I have somebody mid-50s, doesn't exercise, doesn't go out that much, pretty sedentary, they might not really notice their vestibular concussion that much. They don't really do that much. So if you're not doing a burpee or running around and turning around to catch a ball, you don't need your vestibular system quite as much. They might notice it if they're a passenger in a car and they're looking around and they're like, oh, now I feel it. But it's going to be a lot less frequent.
I think I'm getting to the point, Joe, where I'm not going to worry too much about my vestibular system. I'm kind of at that point where I'm past burpees and some of those things.
It kind of doesn't, it degrades with age anyway, but you know how you used to be able to go on a swing and now you don't go on a swing.
Yeah. So vestibular is one type. Are there other types of concussions?
Oh yeah. So another profile we see a lot of is ocular motor. So when you have someone move their eyes, it should usually, now there's other conditions that can cause abnormal ocular movements, but you should be able to move your eyes pretty smoothly. You should be able to track. You should be able to converge, move your eyes in and out. That's your binocular vision working together. And there's some overlap with the vestibular and ocular system. So sometimes people have both, but sometimes you have just one or the other. But yeah, so those people will have a lot of problems with focusing when reading, screen use. They just can get really fatigued through the day, because if they're like, you have to use a computer all day, by the end of the day you're kind of shot because your eyes are just tired. So
yeah. So that's two, vestibular and ocular motor. Are there others?
Yeah. So I don't ever think of them as like a mutually exclusive thing, because a lot of people have multiple things going on. So it is different in that way, with like the comparing it to knee injury isn't perfect, because a lot of times you don't have a lot of different knee injuries at once. But any case, so a lot of times we see cognitive issues, which those can be from probably every other type of concussion, the secondary problem, like, oh, okay, your eyes don't work well. Oh, you can't focus. You could definitely make a mistake doing, a spreadsheet or reading a math problem for school or whatever. Or if you have a vestibular issue and you have to scroll a computer screen, you have to process that movement, that can make you feel really bad. And then you can't do it.
It makes me feel really bad anyway, even without a concussion.
It's interesting listening to this, honestly, because now I'm not going to say that science hasn't advanced since the 1990s or early 90s when I was playing football, but when you got banged in the head, the first thing, okay, how do you feel? Are you dizzy? Did you lose consciousness? And so your vestibular kind of, you were able to walk off the field, and then they want you to follow their finger and track their finger and how many fingers am I holding up, and the ocular side. And then the next was, okay, well, if the play is this and the defense is this, do you know what to do as an offensive lineman, and the cognitive side of it, and probably had no idea what we were trying to do.
They knew, you didn't well, the big thing is now we know how to rehab those things. We have treatment and therapy. Before it was just like, all right, let's just see if you're competent to perform your job right now. It wasn't like, all right, well, let's assess this so we can develop a treatment plan to get you safely back on the field. So it is, you know, we weren't dumb in the 90s and understanding what was going on. We just didn't understand the why and the how enough to figure out how to actually do anything about it. So
I recall, John, I don't know if you had this when you were playing, but there's this whole concept of seeing stars, right? Now, when I was playing in college, maybe in high school, there are times, 2-3 times in my life where I've been hit and there were like stars moving around me, right? Not like big stars, but I saw, and I didn't see flashes. I just saw like points of light that like moved in front of me in my field of vision. And I've read and seen some places, if you see stars, you got a concussion. And if you see stars, doesn't mean you have a concussion. Do you have a point of view on that?
That can be a sign of concussion, but that does not have to be. So you don't have to have any. So our major signs of injury are loss of consciousness. If you lose consciousness, you're getting diagnosed with a concussion, even if you don't have post-concussion symptoms. I've seen people lose consciousness for 3 seconds, get up, go to the hospital confused, have zero headache. I've seen it. It's not normal. It's an unusual pattern, but it happens. And they can perform on testing too. So it's not just they're BSing me. So it can happen. The seeing stars, that's not a true loss of consciousness. I always have to clarify that with patients. Right. Like, they're like, I blacked out. I was like, did your vision go black, or were you out cold? No, like everyone's running up to you and you're laying there. And usually it's, my vision went black. I couldn't process things for a second, but I wasn't gone. So seeing stars could definitely be a mental status change. Is probably from, again, we don't know for sure, but probably from the alterations in blood flow that happen after you have that contact, and the cells have that instant response, and then you can have this alteration of blood flow. So then you get these stars. That's a theory, because like there's no way to test that. But you don't have to have that, but it is definitely a sign. If somebody tells me they had that happen, it's very unusual that then they don't have any concussion symptoms or any other issues. Of course, then you have the people who take a hit, or is hit that you could barely see, and then they're just disoriented and nobody notices except a teammate. Like, why is Joe over here so confused? Why did he blow that play? And then it's like, hey, get out here, it's messed up. So you see that's either confusion, disorientation. Also, it's called post-traumatic amnesia, where, then that person you realize is not laying down new memories after the hit. So they're kind of like, they don't know, they forget who they're playing, they forgot the last play, they don't know the score at halftime. That is like, take them out of the game. They're definitely concussed. So those are the main mental status changes. Some of it you could see like gait disturbance. If you see anything neurological, posturing, or anything like that, that is very bad. That's a definite concussion. I tell people if you have a quick headache or something, then you really need the evaluation. It's just, you can't tell if that's concussion necessarily.
That's fair.
I think I had a headache
you're getting a headache from Joe over here?
No, I was going to say, I think I had a headache from July until December when I was playing football, so I don't think that's part of it. But.
Yes. Yeah. It has to be more than that. But before we move on, I just want to make sure I mention one thing, because you're asking me about the different things, different types of concussions, and it would be amiss to not mention the emotional kind of presentation that can occur. So we see a lot of people with mostly anxiety as a presentation, and that happens for a few different reasons. One is the obvious: I'm injured, I can't play, I'm sad, and I'm stressed about getting back, I might lose my starting spot, I'm not contributing to my team, all that. So that's like, typical, human stress causing anxiety. But there's also some secondary, more physiological anxiety. Like people get very overstimulated with a concussion, lights, noises, and then they can get this physiological arousal, like almost like a panicky feeling. So we see that too. So that's definitely a normal concussion presentation as well to be aware of, and definitely something to treat because it's, anxiety,
Sure.
depression should be taken pretty seriously. So, But yeah, I just want to mention that's another common presentation. Usually doesn't occur on its own. Like you don't just see concussion with just anxiety, but you see it co-occurring with everything else.
Right.
Yeah, that would have been Joe before the start of the second half of the Eagles game. But so with that, I'm going to move us on. If we're good, we're going to move on to third down here, Joe. And a lot of subjectivity, obviously, in the diagnosis of, because there's still information coming in all the time about concussions. And we hear about so-and-so left the game in the NFL because they pulled him out and he's in concussion protocol. So protocol is a big word with that. So taking that, but not necessarily straight from the NFL, if we're talking to a high school program or a high school parent or a youth program or a youth parent, what protocols should be or need to be in place for athletes, and I'm going to say involved in any sport that has a higher rate, because I know football doesn't have the highest rate of concussion of sports that are being played right now. So
That's true.
What protocols should be in place for those athletes, not only for and really, Joe, if we can, let's do third and throw a flag and say it's third down again, and say protocols to diagnose, but then to come back to play.
Yeah, exactly. No, to me, that's all in one, because that's not maybe how the most typical protocols are written, but I see them as a mesh because you can get through the one protocol faster if you're doing a treatment protocol. But let's start, think about what a school needs or an organized team. First of all, you do need, coaches who are trained. It's nice when you have athletic trainers or whoever on the sideline who know how to identify concussion. And concussion's definitely one of those things that you can't count on any medical professional. It doesn't matter what level. You can have an athletic trainer who knows concussion front to back and one who, they're confused on if they didn't lose consciousness, then it can't be a concussion. Right. So, and then same thing with physicians. You have physicians who know everything, and then you have physicians who still tell people to go home and rest for 2 weeks, and then they can go back to play without seeing it.
It's so uneven, Alicia. I've in my time running youth programs, every kid, if I had a kid who was, had a suspected concussion is how I would refer to it. They go to their doctor. There were some doctors who'd be like, nah, he's fine. And there are other doctors who'd be like, he's done for 2 weeks. There's a lot of what I would call unevenness, even in the medical profession, around this particular topic. I'm glad you brought that up.
Yeah, and it should never be just a timeline. It should not be. I don't care how long or short it is. It's not appropriate because everybody's different. We see nice recovery trajectories of your average high school kid is going to get better between 2 to 4 weeks. Just do I clear some of them after 8 days? Yeah, absolutely. If they're ready to go, they're ready to go. Are some people closer to 6 weeks? Yeah. Do you have a very, very, very small percent that take up to 3 months? Definitely. So any sort of doctor that tells them there's just a timeline, run the other way. The other thing to run the other way is if the protocol includes no testing and it's just symptoms. Because all of us have been an athlete at one point, and I think all of us probably would have lied about having a headache if we had a really important game. And this is how really, really bad things happen, like the second impact syndrome. Second impact syndrome doesn't happen if you're testing kids. And I don't think there's really, there's not been that many cases, but of the cases I know of or that I've reviewed, none of them are kid tested normal, back to play, and then that happened. It's all doctor says kid can go back in 3 days if he says he has no headache, or doctor just said he would be out for a week and then he could return. It was all this really poor management. I never saw a good managed injury that happened. So one, getting them off the field right away. So we did a study maybe almost 10 years ago now that showed if you stayed in play, that actually it increased your recovery time by 2 weeks. So that's where that 2 to 4 week span goes. You're kind of more close to the 2 weeks if you get removed, and you're close to the 4 weeks if you stay in. So getting them out of play, making sure they're getting testing before they're returning. They should be performing normally in all those different domains I talked to you about. There should be some at least vestibular and ocular screen and cognitive screen to make sure that they look fine, even if they say they feel fine. And then exertion testing too. Again, you can't just bring your kid into a PCP office and say, oh, okay, how you feeling? Oh, your headache's gone. Good. All right. And they haven't been on the field. They haven't thrown the ball. They haven't run. No, you don't just clear them back to a game. So that's kind of why those like stages, return to play protocols are in, like the 6 stages where you have to ease in. So those are okay, but my concern with those is, again, you have athletic trainers or different professionals implementing those, and there's no actual like standardization to it. So you say, hey, run them through a drill at 50%. So you look at the kid and you're like, you're going 50%? They're like, yeah, I'm going 50%. Like what that could mean something for one kid to the next. So like, when we do exertion tests, we have a standardized, you have to run at this speed. You have to do this drill this many times. You can't make this number of errors. Like we have a standardized, like this is what seems to be abnormal if you're concussed, or this is what's normal if you're not concussed. And beyond that, then we're concerned that your concussion's not gone. So if there's not any real testing, that is a bad protocol. If it's just the protocol of go to your doctor, tell them your symptoms are gone, and then I'm running you through some stages until you say you're fine, that is really not great. That's kind of was great 15 years ago. That's like, oh, that's better than average. But now I would say there's enough multidisciplinary clinics who have more comprehensive evaluations that are far better than what I just described.
So for the parents in our audience, would you, would you advise them to go to a neuropsychologist such as yourself, or a special clinic with certain kinds of, types of doctors, or, as opposed to a GP or just a regular athletic trainer?
Yeah, and it really depends. So like, a lot of programs are neuropsychology driven because we do a lot of the cognitive testing. But then you have other ones that are set up a little different. So like you'll have a physician because they'll do like like a lot of times there's a co-occurring neck injury or something, then we'll have a physician involved as well. And then they might have the neuropsychologist review the testing, or it just really depends on where you're at. So I'm not going to say only go to a neuropsychologist or only go to this. Just go somewhere that is a good reputation for a program. It's a program that does its due diligence. So I think that's different depending on where you're at. Yeah. But definitely, and I'm not here to rip pediatricians or anything, because they're amazing and they do so much and they work so many hours and so on and so forth. But if you see a kid on one of the teams you're coaching and they think, oh, my pediatrician told me not to participate at all. They told me to just rest and not come, and maybe I'll be good in a couple weeks and I can come back. They do not know what they're doing, and tell them to seek care elsewhere. And a lot of times, in Pittsburgh, a lot of times it's a waste of appointment. They say, oh yeah, I think you might have a concussion. Go to the concussion clinic. So now if you're a working parent, you took in off this day to go to this pediatrician appointment. That was a complete waste of your time. You're gonna have to take off tomorrow to go to the specialist. And so I would say if you have the resources in your community to go to a specialist, that is definitely advised at this point.
Yeah. Is it fair to say, Alicia, that protocol, or whatever the protocol may be based on how you were diagnosed, is almost is it comparable to a rehab in a sense?
Okay, yeah. So that thank you for bringing me back to that, because I meant to integrate that. So
no worries.
So when we evaluate someone, a lot of times a typical routine football injury, I might be able to just work with their athletic trainer if they're really competent and experienced, and we can do some real basic stuff and get them better. But there's many times that I send them right to a physical therapist, because not that they wouldn't get better without the physical therapy, but time is of the essence. You have a playoff game in 2 weeks, and it's like, well, we're working kind of on a really tight timeline. We'll do everything we can to try to get you rehab. So where I'm all about, like, once it's been 24 to 48 hours, let's get you going, because that's where the research shows that it's safe to start the exertion and you can cut down on recovery time. So before we worked our way backwards. It was like, is it safe to work out after 2 weeks? Oh yeah, look at people are doing great with that. Is it safe to do 1 week? And then now you can find exertion down to 3 days post-injury, and you're getting better faster. I don't care if you have symptoms, work through the symptoms. This is not, we don't baby people. We push them to work through the symptoms. Obviously, we want to make them miserable and not functional. But if you hide from your symptoms, you won't get better. So there's definitely a rehab component that's like other rehabs with other injuries where it's going to not feel good. It's not going to, you got to strengthen that back up. You got to strengthen that brain back up and get it used to that exertion, that blood flow, that vestibular demand.
Those physical therapists are like physical torturers, right? when I've had to do therapy for knees, or I've had to go for a knee, and it's like they kill you. They work you so hard, but yet I think there's a public perception around concussions. Go sit in a corner and do nothing. And for our listening audience, I think the key here is treat the brain injury with the same kind of discipline, rigor, and process and approach. And by the way, I'm not a doctor, but treat it with the same approach as you would any other injury, right? You're going to exercise that muscle to get back. Now, it's a little harder because you can't see it. You can't get that visible behavioral element of what's going on. But it's not an injury to, Dr. Erin Reynolds is how we met, Alicia. Yeah. And she I love her, and she taught me I'm not afraid of the injury.
Yeah.
Right. I'm not afraid of having a concussion any more than I am afraid of a knee injury or a broken leg.
Mm-hmm. Most likely going to be better from that concussion faster than that broken leg. That's
totally.
I'm gonna blow the whistle, and here we go. I'm gonna take us into fourth down, and Joe, I think it's gonna have to be an overtime because I got one more question for Alicia, and it's not about the birds, but we talk about that not being afraid of a concussion, right? We talk about it's easy with it as a parent, and obviously having 2 kids of my own and a son who's still playing college football, to say, oh, don't worry about the knee injury, don't worry about the shoulder, don't worry about the elbow, don't worry about the, because we know things about that, right? And we see people come back, and it's not demonstratized, it's not theatrical when there's an injury. All that being said, what do parents need to know about head safety and care if they're making a decision about whether or not their 12-year-old or their 14-year-old or their 16-year-old should be playing, should start playing, or should continue playing football?
Ooh. All right. Well, it's a loaded question, but
yes. and not an easy one to answer, I understand.
Where to start, but I mean, I guess one thing, and this usually happens after a kid has had a couple concussions, and there's not everything I can answer. I don't, if we've managed these concussions well, I can tell you that there's no increased likelihood that it's going to take longer to recover the next one. We actually have data on that up to 3 injuries. So I tell them that, but there's parents that still are scared and say, well, I just don't want them to play anymore. It's not worth the risk. You can't tell me if there's any risk for sure. And I go, what else are they going to do? Because, I mean, here's the thing. Maybe if this kid's a football player, but he's also a track star, and he does these other things, and he's going to be a track star or swimmer in college. I'm like, okay, fine. Maybe that's the right decision. I don't know. But if you have a kid that football's their life, and that's their dreams and their hopes, and and then you're like, you take that away from them, what do you think is going to happen? You got a kid that's active, has a team, has all these life lessons they're learning, and also and establishing some pretty healthy behaviors of being committed to doing something, getting exercise, being there for others. And then you're like, oh, okay, yeah, you're just going to come home and play video games, and hopefully you don't make a new friend group and go smoke weed all night, just to be frank, So I sometimes I don't say that to the parents, but I said, well, what are they going to do? I'm like, are they going to stay active? Are they going to keep their grades up if they're a kid that's motivated by sports? There's a lot of, when you take something away, it doesn't necessarily mean it doesn't have effects on other things you're not thinking about. And so I caution parents with that, is like, there's stuff we don't know about repeated concussions, but also, especially the kids who are recovering in a couple weeks, parents, oh my gosh, my kid's had 3 concussions. I'm like, I've seen your kid for every concussion. They recovered in 1 week, 2.5, and 3. I'm like, they're having normal recoveries. They're doing fine. They're still a straight A student. They're blowing testing out of the water. I don't see a reason for you to stop letting them play. But we have that talk. So I think that if you're thinking about letting your kid, if your kid wants to play football, I think you have to lay out the pros and cons, the risks and benefits for you. And it's not the same for everyone, right? So you have to decide, what is my kid going to get out of this? What unique things would they get out of this sport versus another sport? And what are the risks, and what am I unwilling to compromise, or, that kind of thing. So I think that those are the main things I would want parents to think about. But the other thing that popped in my head when you asked that is like, I get all the questions about the equipment and everything. Like, what can I do for safety and prevention? And there's not a lot of strong data. I mean, there's very mixed data, like those Guardian caps. You see some guys wearing them. The NFL has some good data. Then you see some college data that says it's not as good. We don't know if it's a population difference, the way they're studying it different. Basically, I tell people I don't think there's any risk to them, but I'm not going to tell you that they're magic either, because there's nothing come out that convinces me of that. And, same for both, basically everything that's just like a product at this point. There's not anything that has such good evidence that's done in a really, good research way that I can say that's it. And then the other thing is neck strengthening. Sure, that does seem to help some for prevention, but it's never gotten to the point where I've seen like, okay, well, here's the neck strengthening protocol that everyone needs to be doing that's shown that it's reduced. Yeah. There's like there's a study here and there. And going back to should they play? So, there's this whole debate over age of first exposure. So like maybe we should play flag until they're older, and then but I'll just tell you my experience. I don't know the answer. So I'll tell you the data. There's a lot of crappy data on this, and you can find a study that says age of first exposure is bad later on. And then you can find that there's no relationship at all. And I'll tell you, if you don't let your kid play football when they're little and then you let them play in high school, they usually end up seeing me very quickly because they have no idea what they're doing. They're not strong enough to be tackling, and they're weeded out real quick. So I do see a lot of kids who think they might want to play football, freshmen in high school, and then they don't want to play football.
That's one of the biggest, when I was coaching youth, that was one of the biggest things. I would talk to mostly moms. Moms are the ones who make the decisions whether Johnny's going to play or not. Typically, it's been my experience. And mom is saying, yeah, I'm going to let him play in high school. And I would say, as running a youth program, I would say, why? Why are you waiting until high school? Does he want to play? Yeah, he's dying to play. Well, why wouldn't you let him play now? Do you have any perspective? Why is just high school automatically okay? It makes no sense to me, particularly.
I don't. If they think it's because of the brain development, or they think their kid's going to be bigger or stronger.
There's no science around the brain development, like on that. Right. Yeah. If you're going science and brain development, they're not playing until they're 26.
Yeah.
Right. Like.
Yeah. Yeah. It doesn't.
And then they only have a couple of years because then it starts degrading.
It's right. And so what happens is it's cocktail hour conversations is what's influencing that. It's I just decided I thought it would be better, and well, my husband played in high school but didn't play in youth. It's all this anecdotal stuff, and it's not based upon facts and science. And
I think a lot of them just are hoping their kid will change their mind, and they're just buying time.
It's interesting. You tell the story about the mom of the freshman in high school, and I think to myself, it's self-fulfilling prophecy. I mean, if you don't let your kid play when he really wants to play and he doesn't learn how to play, and then he plays for the first time as a freshman with kids that have been playing for 10 years, then you're exactly right. He's probably going to come see you or the orthopedic sooner rather than later.
I am not saying everyone needs to put their kid in tackle football
no,
at
I'm
5
with
years
you.
old.
None of us are.
But
None of us are
saying that.
Yeah,
I just want to be clear
you.
that, like, also, you know, a 14-year-old who has been playing for 8 years and a 14-year-old have not, like, they are not matched.
Right. It's also, I will say this, the first thing that I heard you say, well, it's probably about where my brain stopped thinking, was hearing you talk about being active, being a part of a team, and life lessons. And I think to myself, that's all the reasons that I love this sport, that I support this sport. And so hearing that is phenomenal. So we really appreciate that. Now, Joe's been waiting very patiently. I think we're almost 50 minutes in, probably beyond that at this point. And so we're going to blow the whistle and say the game ended in a tie. And Joe, let's talk about the Birds here in overtime.
Okay. So John, your last comment, my gosh, how much do I love this game?
Right.
I mean, oh my gosh, like, my heart's bursting with love for this game after this conversation. And you know, and yeah, there's probably something to do with the Eagles winning the Super Bowl as well, because they're my team, right? But the effect that this sport has on society is truly remarkable in from my point of view. So I'm going down to the parade tomorrow. There's
Sorry, I cut myself off there. Did you go to the first parade, or at the first
No,
of 2017?
I didn't, because I was out in California.
All right. Well, we got them both covered. I was there for the first one, and you got this one covered for me, because here in Central Texas, I'm not going to make it up
You're
there.
not making up. Exactly. I didn't make it back from California.
Right.
So they're talking about. I think there's roughly 5 million people in the greater Philadelphia area. Might be a little more. That might be a little dated, that number.
Pushing 6, but yeah.
Yeah. They're talking about 1 million people being there tomorrow.
Yeah.
1 in every 6 people in the greater Philadelphia area is going to be at this parade tomorrow. That shows you how meaningful this team, but this sport is, to at least to this city. And God, I so the Eagles game was unbelievable. The Super Bowl was just an absolute butt kicking game. Like I didn't see it coming. I thought it was going to be like the Skins game.
No doubt.
Commanders.
Right.
I thought it was going to be, 14-17 halftime, 10. I thought it was going to be neck and neck.
Yeah.
And then I thought second half Eagles would just start, with their big bully linemen, would just start mowing them down. I mean, it was domination the entire game.
It was. I'll say this,
it wasn't
Joe.
a very good game for a
No, if you're not
person
an
who
Eagles
had no
fan,
team
it's
in
a
the
terrible game.
If you weren't involved, you're right. I was
Yeah.
one of the companies I do a lot of business with is based out of Kansas City, and so naturally there's quite a few Chiefs fans involved.
Yeah.
And it literally by halftime it was almost submission by the fans saying, "Wow, this is not happening, and this is a butt kicking. This is a genuine, good old fashioned butt kicking." So
The thing I thought was, there were a couple things I thought were really, really remarkable. First and foremost, I thought the defensive line, not just getting the sacks.
no, dominant. There's not even words for it.
The way they squeezed the pocket every time.
Controlled the game. Completely controlled the game.
Completely controlled, and didn't give Mahomes really a lot of space to run. Not that there were 1 or 2 plays where he broke out, but it's not like they collapsed one side. It's not like the offensive left tackle just kept getting beat. The whole offensive line collapsed. And
it was
they
domination.
just, I mean, as a coach, you watch it as a coach, and you're like, I can't write it up any better. I got pressure up the middle. I got pressure from both edges. The pocket just collapsed. He had nowhere to go.
One of my friends texted me at halftime, said, "What adjustments do you make at halftime if you're the Chiefs?" And I'm thinking to myself, as an O-line guy, right? I'm thinking to myself, yeah, I got good answers for this one. I hope the halftime show is good, because I don't got very good answers for this.
Three-step drops.
Even
the only
that,
thing, the only thing he could have done is 3-step drops.
Yeah, and that puts yourself in. I mean, that's when you get in big trouble with those athletes. They have reacting to the football with their eyes on the ball.
So the defensive line I thought was unbelievable. I thought Jalen Hurts had the best game of his life. He read the blitzes. You know, a lot of the criticism, and I'm one of them. I'm one of the guys who hasn't been a big Jalen Hurts fan. I'm not anti Jalen Hurts, but I have been historically in my conversations, not necessarily on this podcast, but I've questioned absolutely. Mm-hmm. He did all the things he needed to do. He made quick decisions. He read the blitzes. He threw the ball very well. He made one mistake, and he got away with it. That deep pass that got intercepted because it was on the 3-yard line, right? Which wasn't that bad of a play, to be honest with you. I wasn't when that happened. I'm like, that's I can live with that. He played lights out.
He did.
And then the Cooper DeJean. Oh my gosh!
What a story! The whole thing is a great story. I mean, I don't know if you saw any of the pieces afterwards, and we get caught up in about 5 or 6 of these, but the background with him and Blankenship, and then they obviously talked about the Cooper DeJean draft day and the teammates, and the two of them developing their own T-shirt line, and I can't wait to.
Have you seen that, Alicia? Have you seen their T-shirt line?
T-shirt.
Yeah.
No, I've seen it.
Cooper DeJean and Reed Blankenship are 2 white guys.
Defensive backs.
Yeah,
defensive backs, and so their T-shirts are the exciting whites.
Yeah, they're unicorns in the NFL, and honestly, I can't wait, Joe. And when you you have got to be able to share pictures.
Oh, my husband was mentioning. My husband was being like, "Oh, did you know that this like the only white guy?" I'm like, "Oh, I don't know. I'm a girl. I don't think about positions." My 4-year-old's obsessed with Saquon Sparkly. He calls him. He thinks it's Saquon.
He is very sparkly.
Sparkly!
So am I. So is the 53-year-old here that turns 54 next week. He's obsessed with him too. All right, so we're gonna go here real quick, and we gotta wrap this up, Joe. But I know your prediction for next year that the Eagles repeat. I mean, they got a good ball club. They should be able to. So I know you're predicting that. Alicia, who is your team, and who's winning the Super Bowl next year?
Oh my gosh. Who's my team?
Yeah.
There should be 2 separate answers.
Yeah,
I grew up in the great. Yeah, I grew up in the great state of Wisconsin. So, I grew up a Packers fan, still a Packers fan. I have my association with the Steelers, so I of course have my allegiance there too. But who do I think? I don't know, man. My wild card is the Raiders because I've always thought, what's his face is a good
Pete
coach.
Carroll,
Carroll, yeah. Mm-hmm.
What's his face is a good coach. I will say this: I am going to say that I think the Eagles will still have one of the best teams in the league, and Joe knows this. I hedge my bets all the time. I unfortunately, like you, working with the Steelers, I work with enough different organizations that I have to be very careful about too much of an allegiance. My Eagles allegiance is because of my kids, 100%. But I'm going to go with our producer, Joe, and say the Buffalo Bills are finally going to find their opening and make it and win the Super Bowl next year. So
win it.
Oh.
So with that,
we'll see.
I'll let you wrap us up.
I'd love to play the Bills. I actually wanted to play the Bills this year. But I think the door's open now. I think the Chiefs are human. They're very human.
Aren't we all?
They're very human. All right. Well, Alicia, thank you so much for being
Thanks, Alicia. Appreciate you
the show.
Us.
Really, really great. Love having you in our team as well.
Thanks for having me.
Your input, your perspective is so valuable, and we appreciate you being on the podcast here tonight. That's going to wrap us up for another Unscripted Huddle, brought to you by the National Football Alliance, where we are the greatest advocates for tackle football in America. Our goal, our mission is to honor, improve, and advance the sport every day. We'll see you next time.
Well, that's it for this week. Let's keep the conversation going to help NFA honor, advance, and improve the game of football. Thanks for listening, And join us next time for another set of downs on the Unscripted Huddle.